Hi, I'm going to be talking about uh, excoriation disorder, also known as dermatillomania, and I have some notes I'm going to read from, so here I go. Excoriation disorder, also known as dermatillomania, skin picking disorder, neurotic excoriation, acne excoriation, pathologic skin picking PSP, compulsive skin picking CSP, or psychogenic excretion is an impulse control disorder characterized by the repeated urge to pick out one's own skin, often to the extent that damage is caused. Research has suggested that the urge to pick is similar to an obsessive-compulsive disorder, but others have argued that for some the condition is more akin to substance abuse disorder. The treatment strategies for treating this condition are pharmacological and behavioral intervention. Classification. Excoriation disorder is defined as repetitive and compulsive picking of skin, which results in tissue damage. Its most official name has been dermatillomania for some time. As of the release of the 5th Diagnostic and Statistical Manual of Mental Disorders in May 2013, excoriation disorder is classified as its own separate condition under obsessive-compulsive and related disorders, and is termed excoriation skin picking disorder. Similarities with other conditions. The inability to control the urge to pick is similar to the urge to compulsively pull out one's own hair, i.e. trichotillomania. Actually, I have trichotillomania with my eyebrows and eyelashes. Also, trich is the sister disorder to derma, and vice versa. I have derma too on my lips. I usually just pick my lips when I'm trying to refrain from pulling my hair, or the same reasons why I pull my hair, or my hair. Don't really pull this. Researchers have noted the following similarities between trichotillomania and excoriation disorder. The symptoms are ritualistic, but there are no preceding obsessions. There are similar triggers for the compulsive actions, but conditions appear to play a role in modifying the arousal level of the subject, and the age onset for both conditions is similar. There is also a high level of conformity between those that have trichotillomania and those that have excoriation disorder. A notable difference between these conditions is that skin picking seems to be dominated by females, whereas trichotillomania is more evenly distributed across genders. Research has also suggested that excoriation disorder may be thought of as a type of obsessive-compulsive disorder, OCD. Excoriation disorder and OCD are similar in that they both involve repetitive engagement and behaviors with diminished control, and also both generally decrease anxiety. Nevertheless, Oddlock and Grant have suggested that excoriation disorder differs from OCD in the following fundamental ways. 1. There is a much greater share of females with excoriation disorder. 2. Excoriation disorder may be inherently pleasurable, whereas OCD is not. 3. The treatments that are generally effective for patients with OCD, i.e. SRIs and exposure therapy, are not as successful in patients with excoriation disorder. And 4. Unlike OCD, picking the skin is rarely driven by obsessive thoughts. Oddlock and Grant have recognized the following similarities between individuals with dermatillomania and patients with addictions. 1. A compulsion to engage in the negative behavior despite knowledge of the harm. 2. A lack of control over the problematic behavior. 3. A strong urge to engage in the behavior prior to engagement. And 4. A feeling of pleasure while engaging in the behavior, or a feeling of relief or reduced anxiety after engaging in the behavior. One study that supported the addiction theory of picking found that 79% of patients with excoriation disorder reported a pleasurable feeling when picking. Oddlock and Grant also argue that dermatillomania could have several different psychological causes, which would explain why some patients seem more likely to have symptoms of OCD and others of an addiction. They suggest that treating certain cases of excoriation as an addiction may yield more success than treating them as a form of OCD. Signs and symptoms. Episodes of skin picking are often preceded or accompanied by tension, anxiety, or stress. During these moments, there is commonly a compulsive urge to pick, squeeze, or scratch at a surface or a region of the body, often at the location of a perceived skin defect. The region most commonly picked is the base, but other frequent locations include the arms, legs, back, gums, lips, shoulders, scalp, stomach, chest, and extremities such as the fingernails, cuticles, and toenails. Most patients with excretion disorder report having a primary area of the body that they focus their picking on, but they will often move to other areas of the body to allow their primary picking area to heal. Individuals with excretion disorder vary in their picking behavior. Some do it briefly multiple times a day, while others do one picking session that can last for hours. The most common way to pick is to use the fingers, although a significant minority of people use tools such as tweezers or needles. Skin picking often occurs as a result of some other triggering cause. Some common triggers are feeling or examining irregularities on the skin and feeling anxious or other negative feelings. Complications arising from excretion disorder include infection at the site of picking, tissue damage, and septicemia. I think I said that right, I'm not sure. Damage from picking can be so severe as to require skin grafting. Severe picking can cause epidural abscesses. I think I said that right, I don't know either. Severe cases of excretion disorder can cause life-threatening injuries. For example, in one reported case, a female picked a hole through the bridge of her nose, which required surgery to fix, and a 48-year-old female picked through the skin on her neck, exposing the corduroid artery. Pain in the neck or back can arise due to prolonged bent-over positions while engaging in the behavior. Besides physical injuries, excretion disorder can cause several physical scarring and disfigurement. Excretion disorder can cause feeling of intense helplessness, guilt, shame, and embarrassment in individuals, and this greatly increases the risk of self-harm. Studies have shown that excretion disorder presented suicidal ideation in 12% of individuals with this condition, suicide attempts in 11.5% of individuals with this condition, and psychiatric hospitalizations in 15% of individuals with this condition. Causes. There have been many different theories regarding the causes of excretion disorder, including biological and environmental factors. A common hypothesis is that excretion disorder is often a coping mechanism to deal with elevated levels of turmoil, arousal, or stress within the individual, that the individual has an impaired stress response. A review of behavioral studies found support in this hypothesis in that skin picking appears to be maintained by automatic reinforcement within the individual. In contrast to neurological theories, there are some psychologists who believe that picking behavior can be a result of repressed rage felt toward authoritarian parents. A similar theory holds that overbearing parents can cause the behavior to develop in their children. I don't believe those theories, but that's my opinion. Diagnosis. There has been controversy over the creation of a separate category in the DSM-5 for excretion skin picking disorder. Two of the main reasons for objecting to the inclusion of excretion disorder in the DSM-5 are: one, that excretion disorder may just be a symptom of a different underlying disorder, e.g. OCD or BDD, and two, that excretion disorder is merely a bad habit, that by allowing this disorder to obtain its own separate category, it would force the DSM to include a wide array of bad habits as separate syndromes, e.g. nail biting and nose picking. Steen has argued that excretion disorder does qualify as a separate syndrome and should be classified as its own category because: one, excretion disorder occurs as a primary disorder, not as a subset of a larger disorder. Two, excretion disorder has well-defined clinical features. 3, there is gathering data on the clinical features and diagnostic criteria for this condition. 4. There is sufficient data to create this as a separate category for excoriation disorder. 5. The incidence rate for excoriation disorder is high within the population. 6. Diagnostic criteria for the disease have already been proposed. 7. The classification of excoriation disorder as a separate condition would lead to better studies and better treatment outcomes. And 8. Classification as a separate condition would lead to more awareness of the disorder and encourage more people to obtain treatment. Because excoriation disorder is different from other conditions and disorders that cause tweaking of the skin, it is important that any diagnosis of excoriation disorder take into account various other medical conditions as possible causes before diagnosing the patient with excoriation disorder. There are a variety of conditions that cause itching and skin picking, including eczema, paralysis, diabetes, liver disease, Hodgkin's disease, polycythemia vera, I think that's how you say it, systemic lupus, I'm not sure how you say that, and Prader-Willi syndrome, and I hope I said that right. In order to better understand excoriation disorder, researchers have developed a variety of scales to categorize skin picking behavior. These include the Skin Picking Impact Scale, SPIS, and the Milwaukee Inventory for the Dimensions of Adult Skin Picking. The SPIS was created to measure how skin picking affects the individual socially, behaviorally, and emotionally. And I hope you could understand me, because I talked really fast, and I'm just trying to hurry, because I want to finish all of the stuff real quick. Now I'm going to make another video of this, for, like, the treatment of it, so, this is Dermatillomania-Video 1 or whatever, so, hope you like it, hope you could understand me, hope you found it to be informative and helpful. You can leave comments if you like. Please feel free to subscribe to my channel. I'll give it a thumbs up if you like it. So yeah, thank you. Bye.